Welcome to A New You with myself, Dr. Kristen Watkins, where you're going to learn, laugh, and fall in love with becoming a new you. My goal with this podcast is to help you look great and feel great by bringing you simple, tangible techniques, world-class advice from experts, and proof from real-life patients. Enjoy the pursuit of a new you. Hi, everyone. It is Dr. Watkins. Thanks for joining the podcast today. So today we're talking about something really exciting that I actually have a huge passion in, and that is bioidentical hormones and sexual wellness, sexual rejuvenation. So I actually just wrote a book on this last year during COVID about sexual wellness and what that means. And I have a very special guest today that I can't wait to bring on. I'll introduce her in just a little bit. Let's talk a minute about what sexual rejuvenation means. So sexual rejuvenation is something that people are afraid to talk about. I'm obviously not afraid to talk about that at all. I think that your libido and your love life is part of your vitality, and it's part of the anti-aging process, if you will. If we age to a point where we do not want to be intimate and it becomes a problem, whether that be with vaginal dryness or erectile dysfunction or just lack of desire or, lack of desire with our partner, I think that that's a big issue because it's the love language for so many people. And again, I've talked about this in other podcasts with neurotransmitters and what that means for our brain, but we need to bond with other people and we really need to bond with our partner. And if we're not bonding with our partner in a mental way and in a physical way and in a spiritual way, then we really are missing something from that relationship. And I think relationships that have felt that know exactly what I'm talking about. And a lot of times when relationships have problems and have fallout, that's really one of the big things that's missing. So I think that sexual rejuvenation is a huge topic, all the way from, pain with intercourse to just no desire, to no libido, to actual other physical problems for men and women. And so I really want to talk to my guest today because she's such an advocate for this, her and her husband. So without further ado, I would like to bring on Raye Sanders. If you want to come join me, Raye.
Okay.
Hi. So I'm just going to brag on Raye for just a little bit. Come on over here where we can see you, Raye. So Raye, can you see yourself in there, Raye?
I'm scared.
Come over.
Okay, I'm here. Hi.
So Raye has been my patient for a very long time, over 10 years. And she started with me when I was just doing aNu aesthetics. And then she rolled over with me to the wellness side. And I'll let her tell her little story about that. So first of all, can you just tell me a little bit about yourself, Raye? We'll start there. Go ahead.
Well, the most thing I'm proud of, besides I've been married for 39 years to the same man, and it is my second husband, which is the first choice I should have made, but didn't meet him first. Anyway, I am retired. I am 64 years old and 3 months. 64 years young and plus 3 months, and that's another quarter of a year. But I feel better than I've felt in my 30s, and I feel. I don't know. I get excited about it, just talking about it. But my husband and I were talking one day, probably 10 years ago, and it's been a long conversation. But I wanted him to come to the doctor with me because I thought if I did it by myself, it would be an issue and it would hurt our marriage. And so he would not even think about going to a woman doctor. But I had told him about Kristen, and so he begrudgingly came in. And anyway.
And I won him over. And
he retired also. We are happy. We've had some health issues with him, but they have not gotten in the way of our health, sexual wellness, if you want. Our life is, we're very happy, and it's also brought us so much closer together in sickness and in health. And that's how you lift each other up, and you're there and you're loved. And I think without my knowing it, he told Dr. Watkins that she saved our marriage. Mm-hmm. And that's something I'll always be thankful for.
Yeah. And, it's just making it better, right?
It's wonderful. Yes.
And it's crazy how we don't even think that thing can make that big of a difference, or we don't even think that somebody can help it or make a difference. So that's a good little segue into, I know how we met, but you want to share really quick kind of when you started seeing me at aNu, when you started, what that looked like way back in the day, like 10 or 11 years ago. How did you find me and kind of what happened there?
Well, I accidentally met you one time by going to the ER when you were a medical doctor. And I believe I had a sinus infection, and I didn't have time to take off work. And I ran in there, and I was like, I didn't care. Just give me a prescription, make me better. I want to go. And she said, I noticed a sign and something. I asked her about Botox, because I was getting Botox at a doctor that was horrible to get in. It was hard a lot of years ago. And there weren't as many people involved in it.
No.
So she said, yes, I can take care of that, but we have to set a different appointment, et cetera. So I got in touch with her that way, and I started using her with the aesthetic side. And when I found out she was going to expand her practice, and I really got involved in that. And I really got excited about the wellness side. And I talked to my husband about it, and he was a naysayer, but he has come around full circle. He actually likes Dr. Watkins, and he doesn't like anyone, and he trusts her because he believes that what she says is the truth, because we live the truth.
Absolutely.
And my husband is 70 years old, and we are like I said, in our 30s.
They're like teenagers, actually.
I think our kids do not like the fact that, do we have to call before we come over? Why is the door locked? That's okay. You need to call before you come over. It's just
because this is an important part of our marriage.
And absolutely. And it's been a blessing. It's been it makes us feel alive, even with the health issues that she's aware of that we have that have nothing to do with that side of it. Things come and go. We've healed, and we've continue to love each other, lift each other up, and I do believe that the sexual passion is phenomenal with the hormone replacement. And it's sad, because whenever I see someone that's my age or younger, and I look at them and I think they're miserable because they're not feeling that intimacy, because that brings us together. And it's all I can say, it's been a blessing, and I'm glad and thankful that she was in my life. And so I think, personally, I think God put you in our life for a reason, for our marriage. So
I agree with that. When I was seeing you for aesthetics for several years, and then I was trying to convince you to come over to the wellness side, tell me about your thoughts. What made you decide to come over to the wellness side and actually sit in my wellness room and kind of explore bioidentical hormones in the wellness side? What made you decide to do that?
I wanted to feel passion again. I wanted to feel loved, not just, oh, I love you, in the words, because the words are great, but you want to have something to back that up with. And I also didn't have that feeling of passion that I used to have in myself, and I asked her if she could help me. I didn't think she could. I've argued with her about it, actually, and said, I just think that I'm
She was
old.
A naysayer, too, by the way.
And she made a bet with me, and I actually made the bet with her. I said, I don't believe you can help me. I just don't. She goes, I'll make a bet with you. If you don't get help, I will refund whatever fee you pay me for the visit. But I know that I can help you. I'm not sure. And I said, well, I'll take you up on that, but I know I'm right. You're wrong. And truth be told, I had to say it. I was wrong. She had helped me. And when my husband saw the change in me, and he was ready to come and talk to her also. And that was a big step for him, because guys are,
oh yeah,
he don't have a problem with it now.
No, not at all.
And he will brag. We've talked to other couples about it that are our age, some that are younger, because it happens to people at different ages. But they see how they meet us, and they can't believe how, not that we're lovey-dovey and all touchy-feely around each other, but we are. It's just obvious that we are very happy, very in love, and very tender with each other. And it's a phenomenal thing in my life.
It is, and it's great to see. I didn't get to see Rick prior to seeing him as a patient, kind of see what that looks like, but I know for the last several years what you've told me, the difference. And it's really, what happens a lot is I will see one partner, and then I usually tell the partner at that time, make sure your other partner is aware that you're going to start doing this, because they're going to start to see changes. They're going to start to see changes with you feeling better and having more vitality and more energy, and you're going to probably, possibly have some better libido. And what's going to happen is, I bet within 6 months, I see your partner. And I usually hear, no, not going to happen. And it really happens. Within 3 to 9 months, somewhere in that range, the partner comes in. And a little bit begrudgingly, right? Because they're still thinking, are you really going to help me? I see what you've done for her, but can you really do that for me, right? Because we always think, is there really a way that you can help me feel better? This is, I'm 40 or I'm 50 or I'm 60 or I'm 65. Can I really get that back? Or can I have it when I've never had it before? Right. And so I think that's scary for people to take that leap to know, is this really something I can do? Because it's scary to talk about your intimate relationships and talk about your sexuality and your intimacy and all of those things. So after we started and we were doing bioidentical hormones and you were feeling great, we started talking about some of the other procedures we do. So we also offer the Thermiva and the O shot for women and P shot for men. And we were talking, and I remember that you at first you were kind of a little nervous, and then you were like, sign me up. And so what kind of made you want to jump into also adding some procedures that help with, feeling and sensation and all those things? Was there something that triggered you, or was it just...
I think just reading about it and just what I saw in the lobby, the little literature, and just wondering if it was going to make it any better, I was all over it. And so I did not tell my husband about the Thermiva. I decided that would be a Christmas gift, more or less, a different time of year, but a Christmas gift. And so I had the procedure done and went home that evening, and you have a little numbness when you first go. No, I was not uncomfortable, not pain. The only uncomfortable was the procedure. Wasn't uncomfortable emotionally, just
the being there, just like when you're getting a pap smear or something.
Something different, it was just not something
But not painful.
No, not at all. And when the numbness started wearing off, I told him that we didn't have time for supper. And I said, you'll have to eat later, because apparently it worked right away for me. And he... about 6 hours later, and that's not a lie, he said, I'm going to kill that doctor. Because I got to get some sleep. Anyway, I hate to brag on that, but that's true. And that was probably 7 years ago. Mm-hmm. And it was, I didn't tell him, but he said, what did she give you? And so I had to tell him the truth. But it did make a difference in that area. And it was definitely a reviving experience for both of us.
Yep.
So.
And, the other question I get from people is, how often do I need that? And the question really is, a lot of people will repeat that procedure every year to year and a half, but you can repeat it as often as you want. So I have some patients that want to do that every 6 months, right? Just because they like the results. So they want to continue to enhance that area and bring more sensation to the area. So I have patients all over the spectrum that do it every 6 months to every 2 years. It kind of just depends on what you're treating. Is it incontinence? Is it dryness? Is it you want to have more arousal, libido, those type of things. So I know you've spoken a lot about how this has really helped your relationship and your marriage. What is it about aNu and the things that we offer here that you want to share with other people that we haven't already spoken about, that you're in this office a lot, you come here, and so what is it that you experience here that makes it different, and why you like to come here and what you want to share with everyone?
Well, the first thing I like to share with everyone is every year while I was working, I'd go to the Christmas party, and I wouldn't see a lot of people for the whole year until the Christmas party, mostly the wives, and they go, why do you keep looking younger? Now, and I would say, aNu, and they go, what? And I said, what do you mean aNu? aNu what? And I said, it's a place. And I do believe that I have seen people in here that I wouldn't name, but I see people in here that I know they heard it from me, and it made me feel good that they... Because I've had facials, I've had a lot of different treatments, just because I want to be the best I can be for my age. I'm not trying to, and that's what I'd always say, why do you use Botox or whatever? My theory is I want to be the best 64-year-old I can be, or however old I was when I started, and that is all. I'm not trying to be something I'm not. I just want to be the best Raye Sanders that I can be.
That's right.
And so I have tried a lot of things. There's some things that worked better for me. Other things I wasn't as good, but I've tried a little bit of everything, and I am very pleased. I don't think I look phony. I don't think I look fake. My face still moves because people think your face doesn't move. Doesn't stop me from talking. I don't.
Nothing could stop us from that, right?
But I don't mind. I love to share what I have learned. It's a gift to me. I love to share it with other people so that they can find happiness and joy, because there's nothing worse than a cranky old married couple. And that we are not.
Or a cranky young married couple.
That too.
Because there's plenty of those out there too.
And we don't feel old. We don't. We were to eat with some friends that we hadn't seen for a long time just recently, and they both said, what are you guys doing? Give us the pill that you're taking. What's going on? And my husband actually spoke up. And
Did he really?
called you by name. And he said, this lady saved our marriage. Was it a counselor? Well, no, not exactly. Although she can't counsel you on things. But he just bragged on her and explained. And I was surprised because he's a very private man. But he said it's worth it. It is worth it to anyone, no matter what age you are. If you have issues, there's help out there. But you just have to get over that point of saying you need help.
Right.
And it's been a blessing. So thank you.
Oh, thank you for always being my patient and always having faith in me. So Raye has been a patient for a long time since I pretty much opened, and she's always kind of built me up and lifted me up and been a mentor in a way. And so we always were very honest with each other. So it was really amazing to see this transformation, because I really knew that I could do something to help, and I didn't even at that point know Rick. So to see the transformation that's happened over the years, just with you and through your health and a few health issues with both of you, and just to see the love and the joy, it's really that makes me do what I do. It's the joy that I get to see in my patients when they come in here, and they're in here all the time, and we have a relationship, and I get to be, it's like home. I get to be at home with my patients and really get to see their lives change and blossom over time. And there's nothing like that. And to be on the beauty and the wellness side and be able to take care of people on both sides, because as women, we really feel like how we look on the outside, we feel on the inside, but we also, how we feel on the inside is how we feel on the outside.
Absolutely.
So combining those two, it really was such an important thing for me several years ago to marry those two together. And I think that you're a perfect example of how that works and how it builds confidence in us. So I know why Raye's here. When she's in here with her husband, they come every week and get their turbo shots. And, even during the pandemic, they were coming to make sure they were building their immunity, and they stayed very healthy during all of that. And I think it's just about that community that we build. And it's about relationships, and it's about vitality. And if I can offer a little bit, even a little bit of what you and Rick have to any person, I've done my job in my life.
It would be well worth it. It would be well advised. Good advice to take is to see her, and it would change your life.
Thank you, Raye.
Mm-hmm. Thank you.
So we're also going to do our aNu 2, which I've kind of introduced in the last couple podcasts. So I get to ask you 2 questions. You ready?
Okay, I'm ready.
Okay.
I think.
Number 1, what is I could probably guess what your answer is, but what is your favorite treatment that you've had so far at aNu, Aesthetics and Optimal Wellness? Your O shot.
My O shot.
So, since Raye's been talking about this lovely O shot, let's talk about what that is. So the O shot is where I draw your blood and I spin it down and I get a product called PRP, which is platelet-rich plasma. And then we actually inject it back into the tissue. So I know this is going to sound painful, but the way we do it is not painful at all. And you can ask any of my patients that will tell you. A lot of my staff have had this procedure so that they can explain to patients it doesn't hurt. But we inject a small amount into the clitoris and we inject a small amount into the upper vaginal wall. And what that does is by bringing your own blood and platelet-rich plasma into that area, it increases blood supply, thereby increasing nerve supply, and also helps with collagen. So it helps with incontinence by injecting that upper vaginal wall, and it also helps by injecting the clitoris. It helps to bring engorgement to the area, so blood flow, right? That is what erections are about, whether you're male or female. So it brings blood flow to the area and nerve supply, so more sensation. So it helps with incontinence, vaginal dryness, libido, orgasm, sensation. And the P shot, I'll just talk briefly because men are out there too, because we offer that, and we were kind of alluding to that with Rick. Same principle, and we numb the penis, and there's a couple injections in the shaft, and I know that sounds very painful, especially for men. I will tell you right now, I have had every single male patient I have had has had a positive outcome from it, has had great results, and has never had pain. It's a little bit of pressure and that's it. We numb. There's a very specialized way that we inject it. I'm literally in and out of the room in 2 minutes. The thing that takes the longest amount of time, drawing your blood, spinning it down and numbing. After that, I'm in and out of the room in 2 minutes and that's it. You go on your way. You can do anything you want. There's no downtime. So now that I've talked about it a little bit more, and Raye's kind of talked about it, I'm sure if you have any questions or anything, you're welcome to ask. But The O shot and P shot are as good as people say they are. It's not an exaggeration. That's why I like to bring people on to talk about it, because I can talk about P shot all day and an O shot all day, but I think it really has to come from the patient to say it's not painful and that it works.
And there's the truth in what she says, no pain, and it is well worth it. And the only downside is lack of sleep. So and there's no complaints there. There's a lot of times it's good to be tired.
Oh, if everybody could have some Raye in them. Okay, question number 2. You ready?
Mm-hmm.
What is the next service that you'd like to try at aNu that you haven't had yet?
The one thing that I would like to do is stem cells.
Mm-hmm.
And I have several places, but I've sort of want to do it in my face and in my knee. 2 different places. And that is something that I have been, like my husband, he's had stem cells and had good effects. However, I'm the one that's scared for that. So that's the one thing that I've thought about, talked to you about it, chickened out. So
we need to do it, Raye.
So that is my next venture. That is something that I just, it's not that I'm trying to stay forever young. I just want to, like I said, feel the best I can and keep
Absolutely.
on, when we're 90 years old and we're running around chasing each other at the old folks home. That's all right.
That is absolutely all right.
Our goal is to embarrass our grown children, and we've done well.
And, we're really supposed to, nobody wants to live to be 90 or 95 and not feel well.
No, why?
Anti-aging medicine is not about trying to look or be something that you're not. It's about trying to maintain the vitality that you had in your 30s and 40s and 50s. How do we keep that going into our 70s, 80s, and 90s? Because we want to live that life with vitality. What's the point if we don't, right? So everything that I bring into the practice, whether it be stem cells, exosomes, PRP, hormones, wellness medicine, it truly is all about how do we bring in an anti-aging principle in the terms of, we're all looking for the fountain of youth. We're not going to go backwards in time, right? But how do we prevent time from really getting away from us and us becoming the person when we look in the mirror, that's not who we thought we would be one day. So I'll do anything I can, and I'll always bring things in that will help us remain the youthful person that we want to be. And we can still look like ourselves and be the same version of us, just that better version that we want to be and feel on the inside.
Well, I know it works for me, and I have recommended you to everybody that'll listen.
Thank you, Raye. Thank you, Raye. So thank you, Raye, so much for coming on. Sure. Like I've mentioned before, I've known Raye for so long as a patient, and around here she's like family. So it really means a lot for you to spend your time with me today. Thank you.
Thank you for having me.
Yep.
Appreciate it.
So one last thing I want to touch on with Raye is she is a Lux member, and Lux members get to enjoy 10% off of all of our services, which I think is a huge bonus, and get a free service every month. But something Raye doesn't know that I get to tell her is on June 30th, we are going to have a Lux member invite only swanky Lux Lotus Lounge pool party at our location down in River Market.
Awesome.
I know. I can't wait. So if you want to become a Lux member, it's not too late. It's closed for the party, but it's not too late. So you should be like Raye and become a Lux member.
Do it.
Okay? So if you have questions about being a Lux member, call and let us know. Go to our website. Right now, what we're giving away is, we will give away an O shot. And I wasn't going to do that, but Raye has convinced me. She didn't say that to me, but by her being so passionate about it, I think somebody else should be able to enjoy that. So if you want to get an O shot and be like Raye, then hashtag be like Raye, then go to anuaesthetics.com/giveaway, and you'll fill out a form. You'll be entered into a drawing. And if you want to become a Lux member where you get 10% off, if you don't win and you want to get an O shot or Thermiva, and you want to come to our pool party that's going to be swanky danky and amazing, because I know how to put on a party, and Joni, who's with me, knows how to put on a party. Okay, ladies and gentlemen, then what you need to do is go to our website or give us a call, and we'd be happy to take care of you. Bye. Thanks for joining and listening to aNu You. Please subscribe, rate, and review. And if you have any requests for my next episode or want to learn more, visit anuaesthetics.com/podcast.